Today we have Kimberly Schneider with us. She is a public health nurse with the Wisconsin DHS Childhood Lead Poisoning Prevention Program. Her position provides nursing oversight and education to local health departments for follow-up with lead-poisoned children. Kim will share a short history of lead, sources of exposure, and impacts of lead on children, along with some new testing recommendations for Wisconsin. Sarah Krieger is the lead compliance assistance coordinator with Wisconsin DHS. Field Compliance Unit. This is a newly created position within approximately the last 2.5 years to support the lead investigators by providing report feedback, tools, and job aids, as well as resources to help strengthen lead investigations and help with those reports. Sarah will showcase new tools and resources available to help support those lead investigations. So without further ado, I am going to go ahead and turn it over to Kim and Sarah.
Hi, everybody. As Danielle said, I'm Kimberly Schneider. I'm the public health nurse with the Childhood Lead Program. I'm going to share my screen. I have a short presentation. I've shortened it. I will say, I'm sure some of you know a lot of what I'm going to share, so I apologize for some of the overlap. But in case some of you don't know as much about lead, I just want to share a brief information, and then I'll get to the updated testing recommendations towards the end. So what is lead? Normally I start with the video, but I have a shortened amount of time, so we're gonna just kind of do a little summary here. So lead is a naturally occurring element found in the Earth's crust and has been used for thousands of years. It has generally been used because it is malleable, durable, dense, and a poor conductor of electricity. So common items it has been put into include things like paint, gasoline, plastics, and varnish. Even though it has been determined decades earlier, lead was toxic to children. Lead wasn't actually banned here in the US until 1978 in paint. So due to this fact, it is still present in many homes and childcare centers built before then. So where is lead now in Wisconsin? So as you can see from this map, lead poisoning is actually found everywhere. In the last 5 years, there has been a lead poisoned child in every county in Wisconsin. And this year, we've actually seen an uptick in elevated blood lead levels across the state. And I'm just going to give you a short version of some of the common sources of lead. So main source of lead poisoning in Wisconsin, children, is from deteriorating lead-based paint. So any lead-based paint that is chipping, peeling, or cracking can be a potential hazard. Pre-1978 paint can also be on anything from walls, doors, molding, windows, porches, furniture, or cabinets. Some other common sources also include soil, which can be contaminated from exterior lead paint, leaded emissions, and other industrial sources. Air, so air particles, lead dust can become aerosolized by home repair activities such as sanding lead-based paint or heating it. And then that settled dust can become airborne with vacuuming or dusting, and other certain jobs increase this risk. Water is another common source we hear about a lot right now. Lead in water generally comes from the corrosion in plumbing or fixtures, and this can be done when work is done on lead pipes or there's a disruption in the water flow. Occupational or hobbies is a source usually from take-home lead. So this happens when someone in the home works in a job with lead and can bring it home on their clothes, shoes, or tools. Some of these jobs or hobbies include bullet making, automotive repairs, factories, making fishing lures, eating wild game that was shot with leaded bullets. And I know there's many others that I don't have on here as well. Some other sources, spices, can also be a common source. So a lot of times found in Wisconsin, it comes from chili powder, cilantro powder, excuse me. And other imported items include like candies, cosmetics, dishware, incense, and toys. We have a whole list on our website too. And then the other thing I'd like to mention is you can always look on the Consumer Product Safety Commission's website for recalls on more recent items. Okay, so next, who is at risk? So when we talk about who is at most risk. The main group is children under 6 years of age. So this is due to how small children are, how quickly their bodies absorb nutrients, or in this case, lead, and their hand-to-mouth behavior, and their rapidly developing nervous system. Another group, at-risk group, that I'll just touch on is those who are pregnant. So lead passes through the blood to the baby. So anyone that is pregnant with and has lead poisoning will actually pass that lead on to the developing child. Okay. So now let's get into some of the effects of lead poisoning. Lead exposure causes damage to the brain and nervous system. So it can slow growth and development, cause learning and behavioral problems, and or hearing and speech problems. So many children with lead poisoning are actually referred to Birth to 3 or other early childhood programs. One thing I'd like to point out here is that even when lead poisoning is caught early, the effects of lead poisoning may not show up until years later. So a child poisoned at 1 or 2 may not notice anything until their school age when they tried to read or write. So something to keep in mind when you're out there. And lastly, so Wisconsin does have updated testing recommendations that started January 1st of this year. So our current blood lead testing recommendations now for Wisconsin are to recommend universal testing, which includes all children at age 1, and then again at age 2, and then any child between ages 3 and 5 without a previous test. So this matches Medicaid's testing requirements. So any child on Medicaid is actually required to be tested. Wisconsin now just matches that for all children across this state. I am going to bring up so currently on our website, this is like a poster that that local health departments can use. These are our current testing recommendations. We also put the little disclaimer here that all children under 17 years of age can be tested. If there's any concern by the parent, by the healthcare provider, or if a child is a newly arrived refugee, they are also supposed to be tested. We do have a new communications campaign that we are currently working on, and that should be coming out within the next month or two. We're finishing that up. So by Clip Week, you should have new testing recommendation campaign that we can send out to everybody. So to wrap things up, I know that went really quick. So just a reminder that childhood lead poisoning is all over Wisconsin. Children under 6 are most at risk. Children should be tested at age 1 and 2. And then I have a link here for the Lead Safe Wisconsin tools for outreach. Otherwise, our website is just a great resource tool, and I think Sarah's going to show a little bit more about that. So I will hand it off to you, Sarah.
Great. Thanks, Kim. Hi, everyone. Again, my name is Sarah Krieger. I am the Lead Compliance Assistance Coordinator. As previously mentioned, my key role is to support lead investigators in any way that is needed, and especially with the universal testing and increased testing. Many people who have not done lead investigations recently may be asked to do them. So I am a resource that you can lean on in case you have like questions, you need to like talk through anything, just as a little refresher. I'm going to share the website here. There we go. So just so we know how to get to the resources for lead investigators. So this is our main landing page. And then here under certified lead professionals is the resources. It has, again, my email address, my phone number, also ways that we can help, just if you need a refresher. We also started at the beginning of this year having a quarterly Q&A webinar session. This allows you to bring your topics. We have it so your questions to the Q&A session. We have it so that you can also ask questions anonymously if you don't feel comfortable sharing your questions in front of the group. You can always email me ahead of time and we can address those comments as well. One of the other things that is very helpful is we have more report templates for clearances, lead inspections, risk assessments, and LIRAs. This is just a different format. There still is the other form that you're probably more used to, working with local health departments. I can also show where that is as well. We do also have the checklists just to kind of help walk you through what you need to do during these lead investigations. Again, if you're not doing lead investigations frequently, they can be very intimidating. So these are just little tools to help gain some comfort. Also, if you need help and need somebody to come and shadow you and ask questions while you're doing it, you can feel free to ask us to come along with you, to provide some on-site guidance. Or I've even had people call me while they're in the middle of a lead investigation because there's something that's a little bit weird. So at the bottom of the page, here is the public health interventions, which is more of the childhood lead poisoning prevention site. And at the bottom here is also some forms and templates for, work specification language, a risk assessment report, and a clearance report as well. They're just slightly different formats. So it's whichever one works best for you. And that is about all I have for the new updates of tools. Again, we have our webinar coming up in about a month. I believe it's August 8th. So I hope to see you all there. And again, compliance assistance, if I review a report for you or you ask me for help, it's purely help. It's a fun learning environment. So don't feel intimidated or stressful. I'm happy to help however I can. Thank you.
All right. Well, I guess that's it. Thank you so much. Wow, that was fast. Impressive. A lot of material in a short time. I'll go ahead and keep looking at chat here, and I'll open it up for questions. Well, I'm not hearing or seeing any questions. I know out here I'm out in Pierce County. And I know out on the western north side of the state, a lot of the counties we don't have a lead remediation person trained. It's just not fiscally doable. We just call in the guys from Eau Claire or La Crosse to come up when we have an issue. So some of this, as far as the remediation and all the clearance and all that, it's all kind of foreign to me, but we still run the program and we just call in the other folks when we need to. So I think there's probably a lot of folks on this chat that are in the same boat.
I would agree, but it's nice to know you have those resources now available and you have some
Yeah.
folks to tap into when you are in those situations.
Right, exactly. It's more about making sure people are aware. Because again, in some areas of the state, you can feel pretty isolated when one of these, like, say, you need to do a risk assessment. But just to know that there are options and people you can reach out to.
Absolutely. And if you didn't realize it, there were a couple resources dropped in the chat right to those websites. So if you didn't look yet, please grab a hold of those because those are going to be great tools for your toolbox as well.
I have recently used just a few times already in the last week, the list of certified lead companies. When we have folks call up and have an older house they want to tear down and just looking for help. So I do actually use that list quite a bit.
Right? It's a good starting point
I said I can't recommend any. I don't know them personally, but here. Yeah.
So they can verify that the person is certified
Yeah.
with that list.
Perfect. And I know you also kind of mentioned that you've been seeing that uptick of, I think, Kim, you might have mentioned that, of the cases. Is it related back to COVID? We weren't seeing a lot of people getting the testing done. Do you think that's a outcome of not having testing for those couple of years?
Possibly. We don't have, so I'm sure most of you know, summer is just a hot time for lead poisoning. Kids are getting their doctor appointments for going back to school. Windows are open. A lot of some of that lead dust kind of starts moving around more in summer here. Our estimated guess is that some of that, a lot of kids missed those doctor appointments during COVID for those couple of years when they were being seen virtually or not at all. So that is kind of our assumption, is a lot of those kids now are being seen and just have those higher lead levels that now require that. So I'm sure most of you know, so EBL, that require that investigation of the home. So I'm taking that from what Jeff Reichgill has said, our environmental specialist. He's been out doing 1 or 2 investigations a week throughout the state, and that he said usually his uptick doesn't start till usually another month or 2, but it started earlier this summer. So if that continues on the same trend it has in the past, like, we're in for a pretty rough couple months. But we'll see. Maybe kids are just getting in sooner this summer. I don't know. Yeah, we've seen definitely an uptick this year. I feel like we're definitely trending higher than we have.
Very good. Not that that's good, but it's good to know and to
Right.
anticipate that you
Yep.
may be getting more of these referrals because of that.
Yeah, so we've seen counties that haven't had a case for many years that have required this environmental investigation all of a sudden now. And that's why I think, Sarah, like, we have these new tools. Jeff's been getting calls. So please don't hesitate to reach out if you run into this situation where you don't know exactly what you're doing. We're here to help.
Absolutely.
These are hard, the lead investigations, the risk assessment and clearances, they are hard to do. There's a lot of stuff going on. And if you're not doing 100 of them, it's hard to feel comfortable. So, and I believe everyone understands that as well. So please don't hesitate to reach out for support.
I will put in there too that we want them, not that we ever want them done wrong or okay with them wrong. There's been a little bit more involved with a lot of kids that are eligible for the Lead Safe Homes program, that there's just some more stringent guidelines, I think. I will not get into that because I don't know all of those rules and criteria, but those risk assessments have to be done a little bit more carefully for them to be enrolled into the Lead Safe Homes program. So if that's not done right, it holds up and then has to be redone. So again, like what Sarah said, please reach out. We don't want you having to go out there multiple times to fix just a report.
Mm-hmm. And
I'm watching the
speaking,
chat and it looks like Brian's typing something.
and speaking from like county level experience, you are right. I have unfortunately been one of those people that had to go, part of my team would have to go back in and redo something because we didn't quite hit the correct criteria for that report. So we would have to go back in, especially when it was with the program. So that's really, hit it. Make sure that you're working with all partners. It's not just about working with Jeff and his team. It's also about working with you and your team when it comes to the program as well.
Yeah, so for those of you that may not see the chat, so Brian said he's not sure how many on here are new to lead inspections, but a helpful tip would be to standardize the process. So example, start top to bottom in a room, moving clockwise, sides A through D. This hopefully helps to not miss components if done the same way every time.
That is a really good tip, Brian. That's also one of the things that, like, when I meet with people for like the compliance assistance meetings, after I randomly review their report, I ask for these sorts of tips so that I can like share it with others. So thank you, Brian.
Anything else from the audience? Or presenters?
I have a question for the audience, if people are willing to share, since this recently came up. If you were here in a risk assessor, can you just share some of your, I know my recommendations, but recommendations that you give to families to keep their homes lead safe in the interim between when you go out, find hazards, and then when the actual hazards can be corrected? Because sometimes that can be months, right? And we want to try to reduce the kids' exposure. This question was asked to us from upstairs. And just, we gave our answer, and I know Jeff has quite a few, but I'm just curious on what other tips or recommendations as risk assessors like you give homeowners to try to keep their child safe in that period between finding out there's a hazard and then when it can actually be corrected.
I guess I've heard or seen things like say if there's windowsills being chewed on, to like use duct tape. Sometimes depending on like what area, like I reviewed a report where most of the hazards were in the basement. And I believe the recommendation was to like have like specific like basement booties so it doesn't come back up. Those are some of the things that I've seen.
Not seeing any like hands raised or anybody going off, but Brian Becker did add into the chat, is there a new service, Testudo, maybe it's for recertification? He's referencing that he had received an email on that. Is that anything that you're familiar with?
I believe that is a training provider, so it might be the lead risk assessor refresher classes. I am not. I believe Testudo is going to be providing refresher classes, but I haven't heard anything recently. I'd have to check.
And it looks like Brian put, that was Brian Becker. Here's a different Brian. Consistent cleaning can help reduce those lead dust hazards, and generally like wet cleaning. Saw an article that quantified how much cleaning can reduce lead dust hazards. I would have to dig it up from my grad school research. Thank you both, Brian's, for offering some additional conversation around this.
I guess if anyone has any other ideas, they could always email them to you as well. Think of them later.
I guess one question that I've heard come up is how do you recommend the consistent cleaning without trying to make the family feel bad that they caused the lead poisoning? So does anyone have any tips since you have more experience with this?
I'll give my 2 cents. I do not do risk assessments as I'm a public health nurse, but I do a lot of talking. In the past, I have done a lot of talking with families. Obviously, now I do a lot of talking with local health departments. But Jeff has mentioned in the past, and I think we've talked about this, of making it a team approach. So instead of talking to them, talk with them as if you are grouped together, that like we want to keep this house clean and safe for the child, really focusing on the child's health, not necessarily on the parent that they weren't keeping their house clean, they're
Right.
not doing what they're supposed to. They didn't know it was there, right? Lead dust is very hard to see, as most of us know, almost invisible. Yes, there are ways to clean your home as well, but just giving them the techniques of like, we know it's here now, let's try to clean it up or protect the child. So what we've talked about, I think in the past, like wet wiping, if your local health department has a HEPA vac, offering that or using it while you are there. But really that team approach, so it's not pushing it on them. It's you're there as well to help them, right? So kind of walking them through, maybe not necessarily showing them how to clean their whole house, but maybe using like a windowsill to show them like the wet wiping technique of this is what you can do in the interim to kind of help protect your child. And for those that don't know, I don't know how many environmental health people we have that get put on our helps or clip webinars. We have them monthly. I think in the next couple months here, we're hoping to have kind of a similar webinar of like how to talk to families or different ways, different languages that you can use to bring up some of these conversations are really tough when we talk to families. I mean, you guys are going in there kind of invading their home, right?
Mm-hmm.
It can be a tough where like the nurses are there more or less helping evaluate the child, talking to them. It's a little bit different light. So we are aware of that and we're hoping to bring that to one of our webinars. So keep an eye out for that if you do get our monthly webinar emails.
I think that's going to be a great session when you guys do that. And I would also encourage ways of how to have those difficult conversations, but ways to get access to areas of the home they don't want us to have access to, right? Like, so there is those moments where they don't want you entering maybe the parent's bedroom or a particular room or the basement. And they have their reasons and we need to respect that, but there may be a reason we also need to be down there at the same time or in that particular room. So how do we get that conversation where they can understand why we need access to those areas?
And I had mentioned earlier about our upcoming lead investigation Q&A session. If anyone on this call is not a certified risk assessor or lead investigator and you would like to join that call, just send me an email. It's linked up into on that website that I shared. So I would be happy to send you the invite and the agenda as well.
Thank you. And it looks
Alright.
like Brian popped I'm sorry, Brian, there's so many Brians going on in this
Yeah.
session today. But Brian did pop into the chat, additional resource. So if anybody's interested in getting some additional resources, regarding that cleaning idea, he did pop in a link. So thank you again.
Yeah. Yeah. Okay. Well, it's 9 o'clock. I guess we will close it up. Again, thank you both.